Imagine this. Your beloved grandparent or an elderly family member starts feeling unwell. They're dizzy, tired, maybe a little confused. You take them to the doctor, expecting answers. But instead of a proper diagnosis, you're told it's just part of getting older. Sound familiar? For seniors, this isn't just a possibility. It's a dangerous reality. What if I told you that many seniors are misdiagnosed every day, and those mistakes can be deadly? From overlooked symptoms to a failure in communication between doctors, the risks are all around us. Today, we're diving deep into 5 deadly health mistakes that are all too common when it comes to seniors. These aren't just small errors, they can lead to life-threatening consequences. Stay with us as we uncover the hidden reasons behind these misdiagnoses and how we can prevent them. By the end of this video, you'll know how to spot these dangerous mistakes, and you'll be better prepared to advocate for your loved ones. So, don't go anywhere. This is vital information you can't afford to miss. Welcome to After Older Years, the place where we shed light on the things that matter most. If you're passionate about protecting your loved ones and want to learn more about senior health, make sure to hit that subscribe button so you never miss out on essential tips and life-saving advice. Let's get started. Misinterpreting symptoms as normal aging. Before we talk about the dangers of misdiagnosing seniors, let's consider a common mistake: assuming symptoms like fatigue, confusion, and dizziness are just part of getting older. These signs are often brushed off as normal aging, when in reality, they could signal something much more serious. Take fatigue, for example. It's easy to think that tiredness comes naturally with age, but sometimes it's a red flag for a deeper issue, like heart problems or infections. Similarly, confusion or sudden memory lapses might be mistaken for early signs of dementia, but they could actually point to something as severe as a stroke or infection in the brain. Dizziness is another one. We've all seen elderly people complain of feeling lightheaded, but this could be a warning sign of a stroke, dehydration, or an underlying heart condition. Yet, these symptoms are often written off as simply aging. In fact, this assumption has led to fatal errors. Take the case of a 65-year-old man who was rushed to the hospital with severe symptoms, including fatigue and confusion. Doctors quickly diagnosed him with pneumonia, dismissing the possibility of anything more serious. But the true cause of his illness was gastrointestinal bleeding due to a duodenal ulcer. Tragically, this delay in recognizing the real issue led to his death. When healthcare providers dismiss symptoms as just aging, it can be devastating. And while it may seem harmless to assume a symptom is typical for seniors, the truth is that failing to investigate further can cost lives. 2. Over-reliance on common diagnoses. Before we dive into the next misdiagnosis, let's talk about a common pitfall in treating seniors: the over-reliance on diagnosing urinary tract infections, or UTIs. It's all too common for elderly patients to be diagnosed with a UTI when they present with symptoms like confusion or fatigue. These symptoms, while potentially related to a UTI, are also associated with many other serious conditions. Confusion, for example, is frequently seen in seniors suffering from infections, but it can also be a sign of other issues, like a stroke, dehydration, or even a brain tumor. Fatigue, similarly, is often linked to a variety of underlying health problems that may not be immediately obvious. But instead of thoroughly investigating these symptoms, healthcare providers sometimes jump to the conclusion of a UTI, especially when it's a diagnosis that's already familiar and common among older adults. This assumption leads to the easy prescription of antibiotics without proper testing, which could mask the root cause of the problem. Studies have shown that many seniors are treated for UTIs based on symptoms alone, without the necessary urine tests to confirm the infection. The problem: antibiotics not only contribute to the rise of resistant bacteria, but they also fail to address the true condition. In some cases, these missed diagnoses can lead to worsening health as the underlying issue goes untreated and continues to progress. This over-reliance on UTIs as a catch-all diagnosis can be harmful. Instead of treating the symptoms directly, doctors may ignore signs that could point to much more serious and life-threatening conditions. 3. Inadequate communication among healthcare providers. Before we explore the next dangerous health mistake, let's talk about something that's often overlooked: the lack of communication among healthcare providers. When seniors have multiple health issues, they often see several specialists, each focusing on a different aspect of their care. While this may seem like a good thing, it can lead to problems when these specialists fail to coordinate with each other. Multiple doctors, each with their own treatment plan, can create confusion. One specialist may prescribe medication that conflicts with another's treatment, while another might overlook a problem that seems outside their area of focus. This fragmentation of care is all too common in elderly patients, especially those with complex health conditions. As a result, important issues can go unnoticed, and diagnoses can be missed entirely. Take the tragic case of an elderly man in a nursing home. Despite repeated requests from his family for additional safety measures to prevent falls, the care he received was scattered and disjointed. Unfortunately, he suffered a fall that led to severe complications. The lack of communication between the nursing home staff and the healthcare providers involved in his care meant his condition wasn't properly monitored, and critical signs were overlooked. When doctors and healthcare providers don't share information or work together, it creates a dangerous environment for seniors. The more specialists involved, the greater the risk of fragmented care, and the higher the chance that something important will be missed. Misdiagnosing serious conditions as minor ailments. Before we discuss the next critical error, let's focus on how certain serious conditions are often misdiagnosed as something much less severe, especially in seniors. Heart attacks and strokes, for example, don't always present with the classic symptoms we're used to hearing about, like chest pain or sudden weakness. In older adults, these conditions can show up with atypical symptoms that are easily overlooked or dismissed as minor ailments. Take heart attacks, for instance. In younger patients, chest pain is the hallmark symptom, but for seniors, the signs can be much more subtle. Older adults often experience shortness of breath, fatigue, or dizziness instead of the traditional chest pain. These symptoms are easy to brush off as something less serious, like indigestion or just feeling run down. But this misinterpretation can delay life-saving treatment and lead to more severe complications. The same goes for strokes. While a sudden weakness or slurred speech might be recognized immediately in younger individuals, seniors often present with less obvious symptoms, like confusion, a mild headache, or even just a sudden drop in alertness. If doctors don't recognize these signs for what they are, it can lead to a delay in administering the necessary treatments. In fact, many older adults have heart attacks without ever feeling the typical pain associated with it. Studies show that older patients often experience a more silent form of heart attack, which only further complicates the diagnosis. This failure to recognize the signs of a serious condition can prevent doctors from providing the urgent care needed, putting the senior's life at risk. 5. Medication errors due to polypharmacy. Before we move on to the final mistake, let's talk about polypharmacy, something many seniors face. As people age, they often accumulate multiple health conditions, and with those conditions comes a long list of medications. While these medications are meant to help, taking several at once increases the risk of interactions, side effects, and, unfortunately, medication errors. When seniors are prescribed multiple medications by different doctors, there's a chance that the drugs can interfere with each other. This can lead to unexpected side effects, or even worse, cause symptoms that mimic or mask other health problems. For example, some medications may cause dizziness or confusion, symptoms that could be mistaken for a more serious condition, like a stroke or infection. One common issue is the confusion between similarly named medications, such as Zantac and Zyrtec. While Zantac is a medication for acid reflux, Zyrtec is an allergy medicine. If a senior accidentally mixes these up, it can lead to unintended health complications, especially if they're taking other medications that may interact with these drugs. The dangers of polypharmacy are very real. When medications aren't carefully reviewed for potential interactions, seniors may end up with a dangerous combination of drugs that could cause harm without anyone realizing what's really going on. This mismanagement can make it harder to identify the true cause of a senior's symptoms. which delays the right. Misdiagnoses in seniors are not just common, they're deadly. These mistakes can lead to delayed treatments, unnecessary suffering, and even loss of life. From dismissing symptoms as normal aging to failing to communicate across healthcare teams, these errors have real, life-threatening consequences. Stay informed, advocate for your health, and make sure your loved ones receive the care they truly deserve. Knowledge is power, and when it comes to senior health, it's crucial to be proactive and vigilant. If you found this video helpful, please give it a like, share it with others,